Imagine a healthy and productive workforce with programs in place to prevent and manage illnesses that tend to keep us away from work. Consider the possibility of having readily available resources to help easily navigate through the complex healthcare landscape. Do you want to offer a health plan designed to reduce healthcare costs? Well, we've reached out to patients, healthcare systems, and employers to identify the healthcare needs of our community and the state as a whole. As a result, I'm pleased to share with you that Middlesex Hospital, in collaboration with Aetna and our Value Care Alliance partners, has designed a way to take this from imagination and wishful thinking to a reality every employee can experience.
When faced with a seemingly insurmountable challenge, it makes sense to join forces. This is why the Value Care Alliance, a collaboration of hospital systems, is sharing insight, processes, and resources to deliver consistent, high-quality, and affordable care to the residents of Connecticut. This innovative partnership is made up of Danbury Hospital, Norwalk Hospital, New Milford Hospital, Griffin Health, Middlesex Health, and Trinity Health of New England, along with thousands of affiliated physicians. We all share a common vision focused on managing the cost of healthcare while improving patient outcomes and their care experience. With the addition of similarly capable and like-minded pro-health physicians and Manchester Memorial Hospital, we are now able to cover the state with a network of high-value healthcare providers to serve as the foundation of the innovative Aetna Whole Health product that is the market's best example of value-based insurance design. Partnership with Aetna is a best practice initiative we're implementing to give our patients and their employers the highest quality healthcare at a location close to home at an affordable price.
Our benefit plan options are designed to provide a greater benefit to those who choose to see high-quality, maximum savings providers. So in 2021, we took that one step further and added an ACO-only benefit option. This provided a rich benefit, but limited usage to providers in the ACO network. The plan was designed to drive employees to those maximum savings providers while offering employees a lower deductible and at a lower employee contribution cost, making it a very attractive option. This strategy was intended to increase visibility of the ACO network and gave us an opportunity to educate employees on the importance of knowing the providers they were seeing and the impact of the cost out of their pockets and to our organization. Knowing that navigating provider networks can be challenging, we expanded our employee resources by offering concierge service. Not only is Aetna's concierge service accessible by our employees, but we partnered to provide our employees with a direct contact wellness resource. Our Wellness Navigator, who is essentially an extension of our Human Resources Department, provides one-on-one support for employees looking to better understand their provider options and services. The goal of this concierge service is to direct plan participants to high-quality and low-cost care that they need when they need it, and with the ease of talking to partners who understand the industry.
Hundreds of billions are spent annually by U.S. employers on hours not worked by their employees. That's right. The cost to organizations of covering medical leave due to poorly managed chronic conditions or lack of care coordination is astronomical. In a world of competing healthcare systems and diverse insurance options, tiers, plan design types, consumers face the challenge of figuring out who to see and where to go and what their coverage is to avoid breaking the bank when managing the health and well-being of their family.
We've also partnered to conduct proactive biometric screening clinics on site each year. These screenings identify those moderate and high-risk individuals in our group, many times identifying previously undetected chronic disease. These individuals are then able to seek the right treatment in the early stages, oftentimes slowing or stopping the disease progression. This type of proactive program, with a proven history of success, is critical to our long-term strategy to control healthcare costs and keep our employees healthy.
One of the biggest differences for this plan is that as part of the network, these physicians, hospitals, emergency rooms, and urgent cares are already familiar with each other. Even though they are not owned by the same company, there is just this real commitment to being coordinated on your behalf.
We're talking about consistent, reliable, and transformational healthcare where employees are offered tailored programs to help them prevent or manage chronic illnesses, build a trusting relationship with a primary care provider, find affordable medications, and stay out of the hospital.
The members will be exposed to a one-stop shop resolution, which means that if they need help in managing access to healthcare or have a disease or complications of health, they'll have a medical professional to help guide them and keep them on their care plan. One-stop shop resolution aids the member in getting and staying healthy, which in turn helps everyone achieve success.
Our value-based insurance design uses financial incentives to encourage people to get the right care at the right time from the right provider. Members are asked to choose a primary care provider to serve as their long-term healthcare quarterback.
Primary care physicians are the ones who are going to be directing your care and making sure that you receive the right care at the right place and at the right time. The American healthcare system, very simply, it's complicated, it's confusing, and it's expensive. By using the Aetna Whole Health product, your primary care physician will be able to make sure they're coordinating and streamlining your care. And they will know exactly where you are in your journey, so you receive the care that you need.
Imagine having an employer who cares enough to pay you to be healthy. This well-rounded approach to managing costs for the employee is made possible by Aetna and a broad network of high-value providers spanning the entire state of Connecticut. Our goal is to partner with employers to cultivate wellness in the workplace and engage employees to become active participants in efforts to improve their health and well-being. There are real benefits of this enhanced program. Care teams that include a physician and nurse practitioner or physician assistant to improve patient access so getting in to see a primary care provider is faster. Members will receive a gold ID card from Aetna, which will identify their primary care provider, as well as critical plan and network contact information. The gold ID card will also easily identify Aetna Whole Health Plan members when checking into a provider's office. And we have systems in place to make sure patient information is shared among caregivers, eliminating redundant medical tests and procedures, enhancing communication, and facilitating continuity of care.
By avoiding duplications in services, and then also by making sure that the patients are getting the services that they need, such as diabetic eye exams. If we can get a diabetic eye exam and treat damage to the back of the eye much earlier in the disease, we can save that patient's vision, and we can also prevent lots of costly treatment down the road.
With a focus on preventive care, chronic disease management, managing prescription drugs, and physicians with proven positive results, employers and employees realize unparalleled benefits with the Aetna Whole Health approach. With a primary care provider leading the care for every health plan member, unnecessary or redundant testing and procedures will be reduced.
Instead of competing against each other and driving up healthcare costs in the process, our Value Care Alliance member health systems have established a spirit of collaboration and a willingness to share best practices in order to serve health plan sponsors and plan members better. Joining forces with Aetna has allowed us to be creative and take a smarter and more innovative approach to healthcare delivery to make it more affordable and effective for both employers and employees. I challenge you to imagine what enlightened, high-value hospitals and physicians working closely with an innovative health insurer can achieve by entering into a partnership with you to control healthcare costs and improve the health and well-being of your workforce. I encourage you to consider Aetna Whole Health because I believe it's the vehicle that is capable of making your imagined improvement in employee health and well-being possible.